Welcome back to Retire Colorado with Alicia and Josh Lewis. I'm Bruce Steinbrock. Reach out to the Layman Lewis team. You can, in fact, go to the web, laymanlewis.com. They have spent a lot of time in the last year and 3 months on the website, making it so much more user-friendly and visually pleasing. You can learn about the team. You can learn about Medicare. You can learn about getting a copy of Retire Colorado's very own Peace Out, Retire to Your Go-Go Years book that Alicia and Josh penned.
You guys, our website is beautiful. You got to check it out.
It is. LaymanLewis.com.
If you don't know that, you should.
Yes, You're missing the party. LaymanLewis.com. All right, Alicia, I want to discuss some of the effects of, on the listeners today. What if you're turning 65, but you're still working? Well, this does provide some challenges, but ones that you need to plan for. So I have a friend who loves her job and really has good healthcare benefits with that job through the employer that she's working for. She's not ready to retire. She wants to retire in 3 years, so when she's 68. The question is, does she have to sign up for Medicare at 65?
Great question. And we actually kind of get this a lot. And it kind of depends, because if the employer has 20 or more employees, then they generally can delay the Medicare. But it has to be something that you have to get that approved to make sure that the employer plan is like a credible plan, if you will. So it is something that you'll need to kind of learn about prior to you just making that assumption, right? You want to make sure that you're doing it correctly, because if it's not a credible plan, then no, you won't want to do that. You're going to want to get on Medicare. Even if the benefits are better and, more rich plan or what have you, or you're just kind of used to it and you like it, or if it's free, that's always nice too. But make sure that it's a credible plan with your employer.
Yeah, just signing up for Part A is something that again, it can become the secondary to your plan that you're on with your employer, but then you have you have the secondary. So again, what maybe your first plan doesn't cover, maybe Medicare Part A can cover, and you have less out of pocket. And so it's just smart to do that checking. Another scenario, Josh, is that we hear about all the time is, what if somebody wants to retire at 65, go on Medicare, but their spouse who is younger and only 62 and has been covered under the spouse that's turning 65's employer plan. So again, that you're stopping a job, stopping that employer plan, maybe you have 3 months, but you've got some planning you need to do. The younger spouse is not old enough to qualify for Medicare yet. What happens when this situation comes into play?
Yeah, this is a great question. This comes up a lot, right? This is the peril of having a younger spouse. I think a lot of men sort of idealize that idea of having, a younger wife, and then they get older and they don't think about things like Medicare coverage because it's not fun, right? But you gotta work hard and convince your spouse to work 3 extra years. Because really, Medicare it's an individual insurance only, right? So it's only for that individual. So if the spouse, turns 65, they say, "Hey, I'm ready to retire. Sorry, sweetheart, you're younger, you're on your own," because his Medicare isn't going to cover her. It's going to be on an individual basis. So that's where you got to look at a number of different things, where obviously working longer is a consideration. And that's a big part of something I think a lot of people look at and they go, gosh, health insurance is expensive. How much do I dislike my job? And that sort of changes the narrative a little bit. So you're going to be tasked with a couple different options because the younger spouse is typically going to lose coverage once you retire under your employer plan. So you could go on Cobra. Cobra is going to be a temporary sort of bridge. So depending on how much younger they are, that might actually fill the gap. Typically it's 18 up to 36 months. So generally speaking, you could get up to 3 years of coverage. So again, depending on the age difference, that might be the bridge they need to get to the, age 65 Medicare coverage. But this is typically going to be kind of expensive in terms of what you might be able to find on the exchange. So you could go on to, the marketplace, different type of ACA type exchange, and shop for your own sort of plan there. Private health insurance is obviously something you could, buy into if you're able to qualify. There's also a lot of Medicare type plans out there as well, where you could get on a sort of group plan, but it's through a private organization there. Some of them are faith-based. I'm sure you guys have heard some of those ads along the way, but obviously this is a big factor in determining when to retire. For a lot of people, and looking at that age difference is definitely something that you might have to cover for one of those, spouses who is younger and doesn't necessarily have coverage with the employer.
But I would say, even when people come into our office and they're like, well, I can't retire because if I retire, then it's going to cost us too much in healthcare, because we actually see more people are retiring before age 65 than probably ever before, I'd say.
Well, and if there's ways to keep your AGI manageable, your adjusted gross income, there are definitely still a lot of subsidies out there for the exchange. There's a lot of things going on with some of that coverage right now with what's happening legislatively. So some of those subsidies might go away, but from what we've seen, it's actually, I think, more affordable than what people think. And you can kind of pick and choose through some of that coverage and keep those costs pretty manageable, I think, overall. So it's definitely worth a look, but it's definitely something you want to consider before you get kind of put in that position of like, well, great, now what are we going to do? So again, you've heard the mantra from us before, but it's plan ahead for that sort of thing.
Yeah, but don't automatically think, oh, I can't retire, because that's just, out of the question from a healthcare standpoint. A lot of times it's not. So don't be discouraged by that. Just know your numbers, know what's available. And if you don't know your numbers and you don't know what is available, guess what? Layman Lewis does. So give us a call so that we can kind of help walk you through that and show you your numbers, and then show you the different options and how much that would cost you and how that would affect your overall picture. Because many times it's not as bad as what people think, and they can retire sooner than what they think. But again, know your numbers.
970-446-1234 is that number to reach. Those are the numbers you need to remember so that you can know your other numbers. 970-446-1234. Now, I married an older woman. My wife is 3 months and 6 days older than me. So, I
cradle robber.
Yeah, we calculated it all. But healthcare is one of those things. If you're retiring, or let's say you get to say, my sister, she retired at 60. And they had to figure out, but she and her husband, and who unfortunately passed very quickly after he retired, they had figured out the HSA. And so again, if you're on the high deductible plan and you have some money saved in your HSA, and so they had calculated everything there. But healthcare is one of those things you really need to nail down before you retire, because it can, again, take more from you than you were thinking or planning for. And, a lot of older people, Alicia, they worry about the possibility of needing something like long-term care. Or maybe they need to go into, an assisted living or a nursing home. Now, those are very expensive propositions. How much of nursing home costs are actually covered by Medicare?
Not much. I'll tell you that right now. And I think, unfortunately, people have a different idea, like, oh, more of this is covered by Medicare, but truly it isn't. I mean, it doesn't pay for long-term care at all. It pays for some short-term skilled nursing, up to 100 days. And there's some nuances with that too, where you have to have so many days stay in the hospital. Typically it's like a 3-day stay in the hospital, which the hospital knows that. So typically if they know that you need to go into a short-term, facility, they'll keep you in the hospital for 3 days so that you can get that covered. But, if you don't have long-term care insurance and there's actually a true long-term stay, not just like a rehab situation, Medicare does not cover that. And that's where you need to have a plan for long-term care because it's really, really expensive. And I'm not sure if you listeners out there have heard me say this, but I am not a big lover of long-term care insurance, the traditional.
What?
What? Crazy.
I feel shocked.
I know. I hate long-term care insurance. Now, if you have it, don't like stress out and get rid of it or anything. Sometimes
But Alicia said
people are, grandfathered into some good stuff, but I just don't love it because, and I don't even know if I should go into it.
It's
Should I
real
go
life
into it?
experience. Like
Yes.
we've seen a lot of older policies. When people actually need to sort of employ those benefits, there's some difficulty. They've experienced rising costs, a reduction in benefits.
Or just not getting it covered because you have to fight tooth and nail to get it, get the insurance company to pay. And it's just like this battle. And they're like, we've paid into it all these years. But see, the thing is there's other options for long-term care. There is a lot of other options. And many people don't know about them because they're not working with somebody who really focuses on retirement planning. And that's what we do here at Layman Lewis Financial Group, which is why I am really passionate about this, because we want to make sure that you're covered, and not only that your assets are covered, but also that your choice is covered of, I want to stay home, or I want to go to that bougie place over here. I don't want to go to this really crummy facility over here. So it is really important to plan on that, plan for, some long-term care coverage, but also we want to make sure that you're not planning on Medicare covering that because, well, good luck. It's not going to happen.
So folks,
It's not what it's designed for.
I think what Alicia is saying is get the bougie plan.
Mm-hmm.
And how do you do that?
Yes.
Well, you reach out to Alicia, Josh, and the Layman Lewis team, 970-446-1234, and get bougie with Layman Lewis. 970-446-1234, and we have more Retire Colorado right after this.